Welcome to the deep dive. In Georgia right now, there is this massive kind of quiet shift happening in K-12 education.
Yeah, it's a really fascinating development to watch unfold.
Right. Because schools across the state are starting to realize that, the absolute most effective and honestly the cheapest way to fix chronic absenteeism isn't like implementing stricter disciplinary rules.
No, not at all. It's actually about providing $0 same-day mental health therapy directly to the students.
Exactly. So for you listening today, our mission is to take a deep dive into a stack of program excerpts and financial briefs. They're all about this K-12 mental health support initiative called MentalSpace School.
And we really want to explore how this massive shift in healthcare funding is quietly attempting to solve the youth mental health crisis.
Yeah, by completely eliminating the single biggest barrier to entry, which is, of course, the cost. Okay, let's unpack this. We first need to look at how schools have traditionally paid for these mental health services.
Right, because the historical context is super important here.
For sure. I mean, historically, if a district wanted to hire therapists, they had to fund it out of their own general operations budget, or, they had to rely on these short-term temporary state grants.
Which is incredibly stressful for the administration.
Oh, absolutely. To use an analogy, it's kind of like trying to power an entire high school campus using a rented gas generator.
That is a great way to put it.
Right. It's incredibly expensive. It requires constant manual effort to just keep the thing running. And inevitably, the grant money dries up, the fuel runs out, and the lights just shut off.
Yeah, and the alternative detailed in today's sources operates on just a completely different model, moving away from those temporary grants and tapping directly into Medicaid and commercial insurance network.
Which is a huge shift.
It really is.
Yeah.
It's the equivalent of finally wiring that school into the municipal power grid.
Yeah.
You're plugging into this massive, permanent, highly regulated financial infrastructure that, already exists.
Oh, I love that. So the power is abundant, the system is actually sustainable, and the school isn't stuck trying to generate the energy themselves.
Exactly. And we so often look at youth mental health purely as a clinical issue, right? We focus on the rising anxiety rates, the depression statistics, the different treatment modalities.
Yeah, which are all important, obviously.
For sure. But what today's sources reveal is that providing widespread care is just as much an economic and systemic puzzle. Because, frankly, if the underlying economics are fragile, the clinical interventions never even get off the ground.
That makes total sense. But we have to understand what is actually being plugged into this grid, though. Before we get into the specific financial mechanisms, we need to look at what kind of care is actually waiting for these students.
Right, if the funding is there, what exactly are they funding?
Exactly. And the K-12 support that MentalSpace School provides in Georgia is, well, it's surprisingly comprehensive for a school-based setting. The sources outline a model that features same-day teletherapy.
Yeah, and that operational shift to same-day teletherapy, that's a foundational change in how pediatric mental health is delivered.
Oh, really? How so?
Well, in the traditional external medical model, discovering your child needs to speak with a professional triggers this grueling waiting game.
Oh, yeah. You're calling a dozen different clinics, leaving voicemails.
Exactly. You're sitting on wait list for weeks, maybe even months, just hoping the provider eventually has an opening that magically aligns with your child's school schedule.
Which, let's be real, it almost never does.
Right. So building same-day access directly into the K-12 daily routine, it bypasses that entire logistical nightmare. A student can experience a crisis in the morning and be speaking to a licensed professional by the afternoon.
Wow, and all without ever leaving the school building. That's huge.
It's massive.
And the documentation also explicitly expands the scope beyond just treating the individual student in isolation. The program includes crisis intervention, suicide and violence prevention, and crucially, staff wellness and family counseling.
Because you can't just treat a student in a vacuum.
Exactly. If a teacher is completely burned out from managing behavioral issues all day, or if the family dynamic at home is fundamentally broken, that student is going to struggle regardless of how many individual therapy sessions they attend.
Yeah, the intervention really has to wrap around the entire ecosystem surrounding the child.
Right. And speaking of that, the sources make a really concerted effort to detail the personnel delivering this ecosystem of care. They highlight that these are licensed, diverse therapists who prioritize cultural competency.
Which is so critical in a state like Georgia. When a program operates across vastly different school districts, I mean, you have very rural counties and then highly urban centers.
Yeah, completely different worlds, honestly.
Exactly. So the providers have to understand the specific demographic, cultural, and socioeconomic realities of the students sitting on the other side of the screen.
Because building trust requires a level of cultural fluency that, let's face it, generic outsourced telehealth platforms usually just lack.
Oh, absolutely. They just can't connect the same way.
So there's this very specific sentence in the financial briefs we reviewed that kind of serves as the thesis for their entire model. The text states, cost should never be the reason a student waits for care.
Yeah, that line really stood out to me, too.
Right. The program operates on this premise that families are currently sitting on the sidelines, not because the care doesn't exist, but because of a deeply ingrained misconception about how much that care will cost them.
Yeah, the documentation suggests that many families assume any premium clinical service will just instantly drain their savings. So they don't even bother inquiring about the price.
Yeah, okay. I am going to push back a little on the use of the word misconception here.
Oh, how come?
Well, calling it a misconception implies that parents are just misinformed or maybe they haven't bothered to read the brochure. But the reality of the American healthcare system is that it is genuinely confusing. It's historically opaque, and it is incredibly expensive.
That is a very fair point. The system is notoriously difficult to navigate.
Yeah, I mean, families are so accustomed to hidden fees, bizarre out-of-network surprises, and, getting massive medical bills in the mail 6 months after a routine doctor's visit.
Oh, the surprise bills are the worst.
Exactly. So for a parent, ignoring an offer for quote-unquote accessible therapy provided through a school isn't a misconception. It's a highly learned, totally rational survival mechanism to protect their family from financial ruin.
Yeah, that learned skepticism is incredibly potent. Parents have every historical reason to distrust a healthcare offer that sounds too good to be true.
Right.
But the sources actually validate that skepticism by explaining how aggressively this specific financial model dismantles those historic barriers. They aren't offering a slightly discounted rate or, some complicated sliding scale based on income.
Because that would just trigger the exact financial anxiety we were just talking about.
Exactly. The documents reveal the actual math for Georgia families, and it really revolves around a $0 reality.
Okay, so this is the most significant revelation in the entire stack of research we reviewed for you today. When we talk about dismantling financial barriers, we mean completely obliterating them for a massive portion of the state's population.
It's pretty unprecedented.
It really is. The sources outline that Medicaid covers 100% of these school-based mental health services. It is literally $0 out of pocket for therapy, the initial clinical evaluations, and all the ongoing follow-up sessions.
For any Georgia student covered by Medicaid.
Exactly.
And the psychological difference between low cost and $0 cannot be overstated.
Mhm.
A low cost still implies a financial transaction.
Right. It means checking your bank account.
Exactly. It requires the parent to calculate if they can afford $10 a week or if they need that money for groceries. But by establishing a flat, categorical $0 reality for Medicaid patients, the conversation at the dinner table shifts entirely.
It stops being a stressful debate about the family budget.
Yes. And it simply becomes a question of scheduling. When is the student free to talk?
That is amazing. But, the reality is that many families listening to this right now might be thinking, well, I get my insurance through my employer, so this Medicaid benefit doesn't apply to my kids.
Right. They might assume they're still locked out.
Exactly.
But the financial briefs address the commercial insurance market extensively. For families on private commercial plans, MentalSpace School has essentially blanketed the major providers across the state.
Okay, so who are we talking about here?
They're operating in-network with Blue Cross, Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and Amerigroup.
Wow. That covers a vast, sweeping majority of the commercial insurance landscape in Georgia.
It really does. And for those families, the financial documentation notes they simply pay their standard behavioral health copay, or in many instances, nothing at all, depending on how their specific plan is structured.
Okay, but even with robust in-network coverage, engaging with insurance usually introduces this massive administrative wall.
Oh, for sure. The red tape is endless.
Right. The traditional process of verifying mental health coverage requires a parent to call an 800 number, navigate an automated phone tree, wait on hold for 20 minutes to speak with a behavioral health specialist.
And then try to figure out if a specific therapist offering a specific telehealth code inside a public school is actually covered. It's exhausting.
It really is. But the sources highlight that MentalSpace has streamlined this process entirely. They claim that coverage can be verified online in under 60 seconds with no insurance gymnastics required.
The mechanics of turning a historically frustrating multi-day verification process into a 60-second digital check is just a huge administrative victory.
Yeah, if the cost barrier is removed and the friction of checking insurance is gone, families will actually sign up.
Exactly.
But that immediately raises a massive logistical and legal question. We are talking about delivering a premium, highly regulated medical service physically inside a K-12 public school building.
Right, which brings up a lot of concerns.
Yeah, because schools and hospitals operate under fundamentally different privacy laws. What actually happens to a student's private medical information in this scenario?
Well, the interaction between the educational environment and the healthcare environment is governed by two massive privacy frameworks. And the sources explicitly state that this program maintains dual compliance with both HIPAA and FERPA.
Okay, let's clearly define how those two frameworks actually interact in the real world for you listening. So EPA is the Health Insurance Portability and Accountability Act.
Right, the medical one.
Exactly. That's the strict federal law on the medical side that keeps your doctor from sharing your medical history with your employer, for example. And then FERPA is the Family Educational Rights and Privacy Act.
Which is all about the school side.
Right. It dictates who can access a student's educational records, like their grades or their disciplinary history.
Blending a medical service into a school requires building a system that satisfies both of those simultaneously. And the mechanism of how this works in practice is honestly fascinating.
I was wondering about that. How do they separate it?
Okay, so when a student steps out of their science class and logs into a computer in a designated private room to speak with their therapist, that physical movement is covered by FERPA.
Okay, so the school knows where they are.
Exactly. The school knows the student is receiving an approved support service, and they mark them present. However, the digital space the student enters is governed entirely by HIPAA.
Oh, wow.
Yeah, the licensed therapist is taking clinical notes inside an encrypted electronic health record, or EHR, system.
So the principal, the science teacher, the school counselor, none of them have the login credentials or the legal right to access those therapy notes.
Not at all.
So the physical space might be a converted office in the school library, but the digital space is a heavily fortified medical silo. The students' private discussions about trauma or anxiety do not magically become part of their permanent educational file for any school employee to read.
Right. Maintaining that strict boundary is what allows the program to legally operate. The families are protected both financially and legally.
That is so smart.
But, fixing the family's wallet and securing their privacy doesn't matter if the clinic itself doesn't exist. For the school district to actually open its doors, dedicate physical space, and invite these therapists onto campus, the district's chief financial officer has to see a financial model that doesn't bankrupt the school system.
Oh, absolutely. Which brings us directly to the FY27 budget shift outlined in the documentation.
Yeah, the messaging here is directed specifically at superintendents and district CFOs.
Right. And if we go back to our earlier analogy, this is where the district unplugs that noisy, expensive gas generator and finally connects to the municipal power grid.
Exactly.
Here's where it gets really interesting. The sources detail a fundamental policy shift. School-based mental health programs in Georgia are now fully reimbursable through Medicaid, and major commercial plans are covering the services in-network.
Yeah, so the burden of funding the actual clinical care is shifted entirely off the shoulders of the local school board. It's transferred to the massive healthcare infrastructure of the state and private insurers.
That's incredible.
The documentation explicitly tells CFOs that partnering with an entity like MentalSpace allows the district to deliver this care at a, quote, minimal net cost.
Wow. So the district is really just providing the physical access point, like the room, the internet connection, the logistical coordination. But the government and the insurance companies are the ones actually paying the therapists hourly rates.
Exactly. And alongside that financial incentive of minimal net cost, there is a significant regulatory driver pushing schools to adopt this.
Right. I saw that in the briefs.
Yeah, the sources point to a looming legislative deadline, specifically noting that districts in Georgia must achieve compliance with House Bill 268 ahead of a strict July 2026 deadline.
And the MentalSpace program specifically positions itself as a turnkey solution to help districts meet these new legal standards.
Right. What's fascinating here is how the financial incentives are finally aligning. The government, the insurance companies, and the schools are suddenly moving in the exact same direction.
We are seeing a really rare moment here. I mean, for decades, educators have been begging for better mental health support, but the funding was just completely scattered.
It was a mess.
Yeah. But now you have the state legislature mandating compliance through HB 268, Medicaid and commercial insurance companies providing the necessary sustainable funding mechanisms, and schools providing the localized access points for the students.
The alignment is completely unprecedented. Yet, implementing any new district-wide initiative requires immense coordination, right? It takes administrative effort and a significant amount of change management.
Oh, for sure. So if the net cost to the district is minimal, the families pay nothing out of pocket, and the insurance handles all the complex billing, I imagine districts might still push back strictly because of the operational headache.
Oh, absolutely.
Like a superintendent might fear creating administrative bloat, or they might worry that local parents will push back against the idea of the public school acting as a healthcare facility rather than just focusing on, reading and math. So why would a district still hesitate?
Well, those operational fears are totally valid. But the financial briefs address this hesitation by laying out the catastrophic costs of ignoring the problem.
Right.
The argument presented is that the temporary administrative effort required to integrate teletherapy is vastly outweighed by the massive compounding financial drag of inaction.
Yeah.
The youth mental health crisis is already severely impacting school budgets. It's just, hiding in different line items.
Ah, that makes sense. And the documentation points specifically to where these hidden costs show up, right? Like chronic absenteeism, an increase in disciplinary incidents, and escalating teacher attrition rates.
Exactly. When a student is suffering from untreated severe anxiety, they don't just sit quietly and learn. They act out, they skip school entirely, or they require constant, intensive behavioral management from a teacher who is, let's be honest, not trained as a psychiatric professional.
Right, which leads to total burnout for the teachers.
Exactly. And the sources make a really stark economic argument. Crisis response costs always dwarf prevention costs. Waiting for a student to reach an absolute breaking point, which often requires emergency intervention, legal resources, and massive disruptions to the learning environment, is exponentially more expensive than just paying a therapist to help that student process their anxiety weeks or months earlier.
This is where the return on investment, or ROI, really clarifies the picture. The outcome statistics highlighted in the text are incredibly compelling. The program cites 89% improved attendance, 92% reduced anxiety, and 85% family satisfaction.
Those numbers are massive.
They really are. But we need to connect the dots on how that 92% reduction in anxiety actively benefits the school's bottom line. In most states, school funding from the government is directly tied to a metric called average daily attendance, or ADA.
If we connect this to the bigger picture, the causal chain here is vital to understand.
Yeah, break that down for us.
Okay, so if a student misses 20 days of school because they're paralyzed by unmanaged depression or anxiety, the school literally loses the state funding allocated for that student for those 20 days.
Oh, wow. So if a district has a widespread absenteeism problem driven by mental health issues, they are just hemorrhaging millions of dollars in lost state revenue.
Exactly. Treating the anxiety is the mechanism that recovers that lost funding. When anxiety drops by 92%, students actually feel capable of walking through the front doors of the school.
And attendance jumps by 89%.
Right. The school recoups those previously lost AD funds, effectively allowing the mental health program to pay for itself systemically.
That is wild. Furthermore, when students are present and emotionally regulated, disciplinary incidents plummet. Teachers spend their days actually teaching the curriculum instead of acting as frontline crisis counselors.
Which directly curbs the astronomical costs of recruiting and replacing burned-out educators. Schools aren't just saving money by implementing this, they are rescuing their fundamental educational mission.
Yeah, the math overwhelmingly favors investing the administrative time now to build the infrastructure, rather than paying the continuous compounding costs of a student population in crisis.
It's a huge paradigm shift.
It really is. We began this deep dive looking at a massive shift in how healthcare is funded, and we have traced exactly how that shift is quietly transforming K-12 education in Georgia.
Moving away from the fragile, underfunded reality of temporary grants and fully embracing the permanent infrastructure of Medicaid and commercial insurance.
Right, which creates a $0 out-of-pocket reality for families. For you listening, whether you are a parent trying to navigate the complexities of pediatric care,
Uh-huh.
a local taxpayer wondering how your school board manages its budget, or simply a citizen who cares about the systemic well-being of your community, understanding this mechanism is empowering.
Absolutely.
Because once you realize that the historical financial barriers are largely an illusion and that the bill can be covered by existing Medicaid and in-network insurance, you are equipped to advocate for these highly efficient, zero-friction models in your own local school districts.
Understanding the underlying economic mechanics is always the first step in demanding better systems.
So, for the factual wrap-up, if you want to verify the details of the program we analyzed today, the sources point to their main website, MentalSpaceSchool.com. You can also contact their team directly at MentalSpaceSchool@TrekTherapy.com.
Yeah, and as noted in the sources, that 60-second insurance coverage verification can be completed directly through their digital portal.
Exactly. Super easy.
Before we conclude, I want to offer a final thought for you to ponder long after this deep dive ends.
Let's hear it.
We have explored how seamlessly this initiative blends the educational environment with premium, highly regulated clinical care. If public schools successfully adopt this model en masse, effectively becoming the primary zero-friction hubs for essential pediatric mental health care, how might that eventually force us to completely rethink the traditional boundaries between our educational systems and the broader medical industry in the future?
That is such a good question. If the school building functions as a fully staffed clinic because the funding aligns perfectly, it really raises the question of what other essential community services might eventually be routed through the K-12 infrastructure.
Exactly.
We started today talking about a premium clinic down the street that sat empty because everyone mistakenly assumed they couldn't afford the admission price. When communities realize the doors are wide open, the care is world-class, and the systemic bill is already paid, it fundamentally changes how we view the role of a school. Thank you for joining us on this deep dive. We will catch you on the next one.